Good morning, everyone. So this was the clinical trial on the posterior phakic intraocular lens for the treatment of refractive amblyopia in the children and adolescent. So unilateral or less commonly bilateral reduction in the best corrected visual acuity that cannot be attributed directly to the effect of any structural abnormality of the eye or the posterior visual pathway. And at least there needs to be a difference of 2 lines. This was the older definition. So does it require redefining like the alpha and the sigma female James Bond? Of course, yes. Because it is the only way forward. The eye-brain ability to process the motion, the shape perception, the spatial interactions are there. We are talking about hyperacuity, the contour integration, and the binocular single vision components. So this was the first clinical trial. This is the third in the world and with the highest worldwide data. So we used a Phakic IOL in the children and adolescents from the age group 10 to 19 years. Purpose was to analyze the demographics and the clinical outcomes of the posterior chamber Phakic IOL for refractive amblyopia in the children and adolescent. So it was a prospective interventional study on children from January 21 to 23, registered with ICMR inclusion criteria, ECD of more than 25,000 per millimeter square, ACD of more than 2.8 millimeter because we need to take care of the dome when we are implanting Phakic IOLs. So results, age group from 10 to 17 and total 23 were there with the 14.16 plus minus 3.49 and almost equal male to female in both the groups. So this is the table depicting the mean and standard deviation of preoperative vision uncorrected to the last visit. So visual acuity improved 1.39 to 0.11 at the last visit. Again, when we talk about the uncorrected visual change from preoperative to the third visit after operation, again there was a significant p-value from 1.11 to 0.05. If we talk about the gain in the visual acuity lines, the uncorrected visual acuity and the best corrected post-op visits, so first day it improved to 11.3 lines and the last visit it was 12.1 line. When you compare the contrast sensitivity between the preoperative and the postoperative period, so it improved from 1.07 to 1.66 with a significant p-value. And we compare the postoperative endothelial cell count at the last visit, so there was only a loss of 5.78% in these group. Patient satisfaction, almost all the patients were satisfied. And we compared the stereo acuity, so it took the most large time, longer duration from more than 800 millisecond of arc to 150 millisecond of arc. So this was the last to improve. These are my references. So in conclusion, Phakic IOLs can be a preferred choice for management of amblyopia in children with no incidence of corneal haze, anectasia, good refractive results with stability and good quality of vision, faster visual acuity with flat learning curve, no PI is needed in the newer designed IOL, and more multicentric clinical trials with long-term follow-up are needed for results to be more conclusive and to look for the side effects of Phakic IOL like the glaucoma, like the retinal detachment, like cataract. And stereopsis, of course, took longer time to improve. Thank you so very much.
Thank you, Dr. Arvind. Actually, I mean, it's quite a novel approach, and I mean, a lot of good results are, the initial phase are coming. We have to see the long-term results of Phakic IOL in children.
Yeah.
I think we are running short of time, so